treat them like they're our family. I wouldn't treat anybody in here different from what I treat my mum, my dad, brothers, kids. I love it, and I think they see you love your job, and then they actually relax and quite enjoy having blood taken. If they've got to have it done, they might as well have it done in a fun atmosphere.
It has been my hospital where I see private patients since I first started as a consultant in Bath. I can say without any hesitation, all the staff from ward right up to senior management have been amongst the most helpful staff I've had to work with in any organisation.
When you meet a woman 5 years after their breast cancer treatment and they're in a supermarket with their 3-year-old child, and you've seen the positive impact that that's had on saving that patient's life and helping them to have a family. I don't know what else to say on that one, really.
Sally came to me a couple of months ago with an injury to her knee. She's making really good progress through her treatment pathway and is on the road to recovery. I'm sorry to hear you've injured your knee. I gather it was at the weekend.
I chose to come to Bath Clinic because of a family recommendation. My granddad had his hip replacement done here. He raved about it, and after a bit of research, even though there was quite a few places in Bath that I could have gone to, this was the standout one for me, and it was the no-brainer.
We're all like a family, really. You know, some of us have worked here for many, many years throughout the hospital, and there's always a friendly hello to be said in the corridor. You know, it doesn't matter which department you're from. We all know one another. I'm Mary Ann Steele. I'm the Clinical Services Manager of the Imaging Department. I have pretty much everything under our belt here in the Imaging Department. We have an MRI scanner, CT, ultrasound, mammography, fluoroscopy, and plain film X-ray. Every patient has an individual need, and we establish what that patient's needs are, whether they want somebody to hold their hand while they're in the scanner, whether they'd like to wear an eye mask or just be able to try and look out the scanner. We adapt what we're doing to try and help that patient get through the scan.
It would be reasonable for a patient to get an MRI scan over the course of a week or so. Once that scan is available, then it can be reviewed with myself after input from the specialist radiologists and discussed with the patient. You can see that there's important ligaments here inside the knee and down the side here. And those correspond to this area here on your scan, and an initial recovery and rehabilitation process can be discussed.
I'm Anna Bunce. I'm the Physio Manager here at Bath Clinic. We've got a team of highly experienced physios. We're split between inpatients and outpatients. So inpatients are patients on the ward who've had operations, so we'll see them post-operatively. So that's things like joint replacements. So if you come here for a hip replacement or a knee replacement, then you'll see a physio. Usually now on the day of surgery is when you'll see us for the first time. So say if you've had your operation in the morning, we'll come and see you in the afternoon, and if you're feeling ready and well enough, we'll help you up for the first time and help you with walking and also your exercises as well. And then the other side of our work is outpatients, so that's where patients come in with all variety of conditions like hip pain, back pain, neck pain. Patients can self-refer, so they don't have to go via their GP. You can book in yourself and refer yourself to physio.
Sometimes careful rehabilitation and time for things to recover is important, and then scheduling surgery. That then can be performed using the latest anaesthetic techniques, very often with people going home on the same day as the operation.
Okay, so we've got one patient this afternoon, Mrs. Hill. Hi, I'm Trudy, I'm the theatre manager here at the Bath Clinic. We've got 3 theatres here, and we've got a great team of staff who look after the patients.
This is where the patient would arrive from the ward. Before they come down, as a team, we all check what's going on with the list. We have what's called a team brief meeting where we identify who's on the list, what each patient is having done, and whether there are any particular issues relating to each patient which might affect things. Once we're happy, we send for the first patient, and they arrive here. There's a whole team of people that get them ready for the operation with the anaesthetist, the operation department practitioner or ODP, and there's always 1 or 2 nurses here as well as the surgeon. Once everything is prepared, we take the patient through into the theatre there and have another check before we start the list to make sure everything's in place, and then we get going with the operation.
The recovery and the rehab then starts early. They should be off their crutches hopefully nice and quickly. They should be moving their knee hopefully nice and quickly. They may or may not need a brace for a short period of time after the surgery.
So all the staff that I've come in contact with have been lovely, very helpful, just a wonderful environment really. I've enjoyed how helpful people have been and how compassionate and lovely and approachable. Everyone seems to care.
I've always enjoyed working here. I think it's a very friendly hospital. Things can be organised more quickly. Patients get a room of their own, very relaxed atmosphere on the ward. If I were to have an operation, it would be somewhere I would like to come, which is, I think, you couldn't ask for a better advertisement than that, really.